Good day, everyone. Welcome to the fourth webinar of the Master of Science in Radiologic Technology students of Davao Doctors College. In today's webinar, we are going to discuss or we are going to discover the current and future trends of the radiological sciences modality, which focuses on the magnetic resonance imaging, the computed tomography scan, ultrasonography, single photon emission computed tomography or SPECT, and as well as positron emission tomography. In this webinar, we are glad with the different radiologic technologies who are expert in these fields to discuss on the matters on the radiological sciences, trends, and okay. So now, to start with, let us call on Ms. Janice Alvaran to discuss on the current and future trends of magnetic resonance imaging.
Trends in MRI. MRI or magnetic resonance imaging. MRI scanning is a non-invasive and painless procedure. It is discovered by Raymond Damadian, created the first MRI full-body scanner, which he nicknamed the Indomitable. The cost of a basic MRI scanner starts at $150,000 but can exceed several million dollars. Japan has the most MRI scanners per capita with 48 machines for every 100,000 citizens. At the most recent, long MRI is now possible. At RSNA 2015, Toshiba introduced its ultra-short echo time sequence for dedicated pulmonary MRI. Available in the Vantage Titan 3.0T MR system, UTE allows clinicians to view tissue with very short relaxation times and high susceptibility regions where signals generally disappear too quickly for accurate MR imaging. Software greatly reduces MRI scan times. Simultaneous multi-slice, or SMS, is a paradigm shift in MRI, helping cut total MSK exam times by up to 46%, reducing DWI scan times throughout the body, and significantly improving temporal resolution for bold fMRI. SMS has expanded its capabilities, now providing high-resolution, distortion-free DWI, with result for up to 60% shorter scans. SMS can also be seamlessly combined with two conventional parallel imaging, enabling additional scan time reduction as a factor of slice acceleration. SMSTSE enables scan reductions as a factor of slice acceleration. Entire foot and ankle scans covering all relevant contrasts and orientations, for example, can be performed in only 7 instead of 13 minutes while maintaining image quality. Time savings may also be invested in higher spatial resolution or thinner slices while maintaining the original scan time. SMSDWI maximizes productivity for diffusion weighted imaging of the brain, breast, abdomen, and pelvis, with acceleration factors up to 8. SMS for DTI and BOLD bring advanced techniques such as pre-surgical mapping into clinical routine. SMS result further expands the footprint of SMS accelerated applications by enabling high resolution, distortion-free DWI scans in significantly shorter time. The benefits of SMS diffusion. Or benefits of simultaneous multi-slice TSE. Scan time reduction as a factor of slice acceleration. Higher spatial resolution or thinner slices. Entire MSK exams can now be performed in about half the time, enabling significantly shorter exome slots per patient. Benefits of simultaneous multi-slice diffusion. Scan time reduction, the reduction is a factor of slice acceleration. Higher spatial resolution or thinner slices. Improved diffusion resolution, more directions and B values. Simultaneous multi-slice speeds up imaging significantly to simultaneous multiple slices. Together, simultaneous multi-slice SMS, TSC, EPI diffusion, resolution distortion-free DWI enable significant time savings from head to toe. Silent MRI scanning is now possible thanks to GE's healthcare's silent MRI scan. One of the has successfully reduced noise levels since it acquires pre-induction decays rather than echoes, like a traditional MRI does. Critics have complained, though, that because of a longer readout time, the silent device produces unclear images. Silent MRI scanning benefits children who are sensitive to sounds or people who are sensitive to sounds. Since children are more sensitive to noise or their anxiety level rises when they hear noises, especially in a hospital background, it benefits them tremendously as it eases their anxiety and gives them that calm feeling. Simplifying cardiac MRI. So the new VSWorks cardiac MRI software helps automate the image sequences to perform a full 3D chest volume scan that includes the full motion of myocardium during the cardiac cycle, blood flow time, and fully automated quantification to create what he calls a 7D cardiac MRI exam. VSWorks also speeds the imaging time from 70 minutes down to about 10 minutes using a single free breathing exam. Non-invasive first pass perfusion using exogenous, and these new techniques were successfully used for characterizing diffuse myocardial fibrosis associated with myocarditis, amyloidosis, sarcoidosis, heart failure, aortic hypertrophic cardiomyopathy, congenital heart disease, restrictive cardiomyopathy, arrhythmogenic right ventricular dysplasia, and hypertension. Diffusion MRI provides information regarding microscopic tissue structure, while diffusion tensor imaging helps characterize the myocardium and monitor the process of LV remodeling of AMI. This images shows a tumor almost filling the entire left atrium. So the A still frame from horizontal long axis sign sequence showing the tumor almost filling the entire left atrium, black where the black arrow is pointing, while the B T1 weighted turbo spin echo image on the same view with the mass where the black arrow appears to prolapse through the mitral valve, obstructing flow into the ventricle, therefore resulting in functional mitral stenosis. The latest would be the Magnetum Terra 70 MRI. The Magnetum Terra 70 MRI is for patients who weigh more than 66 pounds and is limited to examinations of the head, arms, and extremities. It is most effective in diagnosing cerebrovascular diseases and/or diseases involving the brain. With its higher signal-to-noise ratio and contrast-to-noise ratio compared to lower field strengths, high-resolution contrast-rich images can be obtained of diverse pathologies like multiple sclerosis, brain tumors, aging-related changes, and cerebrovascular diseases. And some of these diseases with additional pathophysiological information can be gained compared to lower field strengths. Because of the clear depiction of small anatomical details and high lesion conspicuousness, earlier diagnosis and start of treatment of the brain diseases may become possible. Furthermore, insight into the pathogenesis of brain diseases obtained with 70 MR could be the basis for new treatment developments. The magnetic resonance elastography. MRE is being used clinically for assessment of patients with chronic liver diseases and is emerging as a safe, reliable, and non-invasive alternative to liver biopsy. For staging hepatic fibrosis, MRE is also being investigated for application to pathologies of other organs, including the brain, breast, blood vessels, heart, kidneys, lungs, and skeletal muscle. Non-invasive measurements of mechanical properties of the brain tissue using magnetic resonance elastography has been a promising method for investigating neurological disorders such as multiple sclerosis and hydrocephalus and Alzheimer's. However, because of the regional and directional dependency of brain stiffness, estimating an isotropic stiffness is important. This study investigates isotropic and anisotropic stiffness as a function of age as well as correlation between isotropic and anisotropic stiffness. This is a promising method for investigating neurologic disorders such as multiple sclerosis, hydrocephalus, and Alzheimer's. And that would be all for my report. Thank you.
Hello everyone, good day. My name is Julius Jaro Merable. I'm a registered radiologic technologist, and today I am going to talk about the current and future trends in CT scan. So first, as an overview, computed tomography is a diagnostic imaging test that uses X-ray to measure the projection of internal organs, bones, soft tissue, and blood vessels. The cross-sectional CT scan generates three-dimensional images which can be viewed on a computer monitor, printed on film, or transferred to electronic media. Previously, CT scans operate using 16 to 64 slice system. Today, scanners have evolved to a more sophisticated 80 to 64 slice system. As the demand for more innovative detector technology, spectral imaging, and iterative constructing software to enhance diagnostic images is on the rise, the advances in cardiac, gastrointestinal, and pulmonary CT scans will continue to upgrade. So CT scan advancement. First, we have upgrades in new detector system, the spectral CT imaging upgrades, AI assistant in CT imaging. First, upgrades in new detector system. Latest CT systems are being manufactured in order to lower dose and increase image quality. So, for example, GE, Philips, Siemens, and Canon introduce new technologies. So, for example, the GE, they have the filtered back projection, which I think is being used today, widely used today. Then they have the adaptive statistical iterative construction, which contributes to image improvement. So, adaptive statistical iterative construction, meaning ASIR, other term is ASIR, is a technique that allows radiologists to reduce the noise in an image and improve image quality, it's like adjusting a TV antenna to make a fuzz image sharper, while reducing the radiation dose to only 1/4 of that delivered by typical abdominal CT scan. Then next we have the VEO or VEO. This is also a reconstruction system that makes the CT scan enabled to perform chest CT, which has similar dose to chest X-rays without reducing the quality of the image. For Philips, they have DICOM, dose structured reporting. So they are more on the system itself, the operating system on the side of the radiologic technologies. CT dose check, automatic exposure control, pediatric and adult reference, which is I think widely used today. So example, the image on the right is taken or reconstructed using the filtered back projection, while the image on the left uses adaptive statistical iterative reconstruction. So there is a significant difference in image quality. The other is kind of grainy, and the other is smoother. The resolution is higher. So next we have the spectral CT imaging. It is a way to visualize tissue composition with CT. So with this, we can determine the atomic number of the tissues in the body, and if patient has received iodinated contrast, spectral CT can determine the amount of iodine in the tissues and virtually subtract the iodine. So as I have observed, we usually subtract those organs or those vessels that doesn't have iodine. Now with this, the iodine can literally be subtracted from the vessel. So there's a possibility that direct contrast imaging will be applied without the need for double exposure. But again, it is quite challenging because we need to have a plain film or scout images and images that does not have contrast in order to see if the patient have any contraindication to the contrast, and also for patient safety. So I think that application is not yet widely used for today. Next, we have the advantages of spectral CT. It can help decrease the contrast load in patients with poor renal function because the amount of contrast can be measured. So contrast media can be diluted in water in order to reduce the contrast load in patients with poor renal function. It can also enhance detectability, improve tissue characterization, reduce radiation by eliminating the need for true non-contrast images, which I have mentioned earlier, but I think this will be a difficult application due to contraindications of using contrast media. So next, amplify or remove iodine. Lower KV images can be used to salvage bad CT angiograms, do low contrast dose CT exams, and increase conspicuity of lesions. Next is iodine mapping. Iodine-only images can be used to look at tissue perfusions and determine if lesions such as cysts require further workup. Next, we have the characterize tissues or determine the composition of kidney stones and joint crystals. Spectral curves can be used as CT fingerprint of tissues in question. So AI in CT imaging. So this is really exciting because as CT scan or as imaging technologies are continually innovated, the AI in CT imaging is possible. It could facilitate automation to review images for physicians and radiologists. Also, in the side of radiologic technologies, AI can reduce the time of the actual procedure by managing auto-centering technology. So there are CT scan manufactured today that have auto-centering capability. You only have to position the patient on the CT bed, then the machine can automatically center the patient based on what examination is required. So this is a sample of an AI technology using automation to facilitate review. So instead of having the doctor or the radiologist count the number of spine or determine the particular spine where the disease is located, is localized, so there are already labels. So at one glance, the radiologist may know which part of the spine is in need of further evaluation. So this is very useful. This reduces the time for the radiologist to study the image. It literally removes the process of counting the spine in order to determine the number in which the spine is, in which the disease is located. So for the future, every day new application of CT imaging technology is discovered and studied. The vertebrae will not be the only part labeled automatically. Maybe in the future, even vessels will be labeled automatically. So radiologists can concentrate more on determining the disease rather than determining which part the disease is on. So looking forward to the future of CT, radiologists should expect to see faster, more automated, and easier use scanners. The technology will transition from good interpretation tool to a machine with more quantification and a speedy and direct diagnosis. So these are my references, and that's all for my discussion. Thank you and God bless.
Hello, good day everyone. Manuel Delisay here, reporting for the latest trends in ultrasound imaging. I have identified 5 aspects which the ultrasound imaging is progressing. These aspects mainly contribute to the technological advancement of ongoing development of ultrasound imaging. These aspects are improved image quality, volumetric ultrasound, elastography, CEUS, or we call it the contrast enhanced ultrasound, and of course, influence in healthcare reform. Let's start with image quality. Image quality includes real-time computing imaging, increase of computational power in the system, which uses more sophisticated computational algorithms for enhanced ultrasound imaging. Here is the example of an umbilical cord with enhanced image quality of ultrasound imaging. As you can see here, the image is sharper, edges are well defined, contrasts are clear, color Doppler is very enhanced, even the cord twists are defined. Volumetric ultrasound. Volumetric ultrasound focuses more on the visual volume, replicating an actual appearance of an organ or tissue. The ability to visualize the real-time tissues and organ are improved. Thus, this is the essential foundation of a 3D and 4D imaging ultrasound. Next is elastography. Elastography is the measurement of tissue stiffness. Helps us identify fibrosis, cancer, and breast lumps. The most common application is the liver elastography, which is the investigation of liver fibrosis. Liver tissues are graded in a computational way, yet to identify the fibrosis. Fourth one will be the CEUS. or shall we say the contrast-enhanced ultrasound imaging. Contrast-enhanced ultrasound imaging uses more advanced contrast technology. The contrast has a complex structure that reflects sound waves, and that structure is termed as microbubbles. This is an example of a comparison ultrasound imaging with and without contrast enhancement. Last will be the influence of ultrasound to healthcare reform. As technology improves, more doctors are pushing for maximum utilization of ultrasound imaging. We are currently using the ultrasound imaging for screenings, biopsy, and procedural guidance. In relation to our unit, more doctors, even the surgeons, are leaning towards ultrasound diagnosis. Due to its quickness and effectiveness of evaluation, ultrasound guidance will soon be abundant in the medical eye. Thank you for listening. We can now proceed to the next reporter.
SPECT, positron emission tomography. Positron emission tomography builds images by detecting energy given out by decaying radioactive isotopes. Radioisotopes are radioactive isotopes of an element. They can also be defined as atoms that contain an unstable combination of neutrons and protons or excess energy in their nucleus. Nuclear medicine uses small amounts of radiation to provide information about a person's body and the functioning of specific organs, ongoing biological processes, or the disease state of a specific illness. In most cases, the information is used by physicians to make an accurate diagnosis. In certain cases, radiation can be used to treat diseased organs or tumors. How are medical radioisotopes made? Medical radioisotopes are made from materials bombarded by neutrons in a reactor, or by protons in an accelerator called a cyclotron. A positron emission tomography scan is an imaging test that allows your doctor to check for disease in your body. PET systems use the path of two detected gamma rays to determine the originating collision point, a process called electronic collimation. The scanners use a circular series of gamma ray detectors to envelop the patient or test animal to detect both gammas so the instrument can use electronic collimation to predict where the energy signal originated. This signal is then converted into a three-dimensional image slice. Here you can see a picture of two well-known brand producing PET scan machines, Toshiba Celestron 32 PET scanner and a Siemens Biograph Horizon PET scanner. These two machines is probably the best PET scanner by brand in the market today. 1974, the first PET camera was built for human studies by Edwin Hoffman, Michael M. Terpagosian, and Michael E. Phelps at Washington University with DOE and NIH support. Phelps, who is often credited with inventing PET, received the 1998 Enrico Fermi Presidential Award for his work. 1977, the first full-body PET scanner was built. And by the year 2002, the first PET center was built in the Philippines. Here in the picture was the first PET camera built for human study. Following several prototypes, the inventors at Washington University built the PET-3 to use advanced algorithms for computing three-dimensional images. In 2002, St. Luke's Medical Center in Quezon City opened the first PET center in the Philippines and in Southeast Asia, with Dr. Jonas Francisco E. Santiago as its first director. In 2008, St. Luke's Medical Center acquired the first PET CT scanner. And by 2020, we have now 3 PET centers and 2 cyclotrons working in the Philippines. And as of now, there are 400 PET centers around the world serving its patients. Here you can see the picture is a modern cyclotron. By the way, a cyclotron is a type of particle accelerator invented by Ernest O. Lawrence in the year 1929-1930 at the University of California, Berkeley, and patented in 1932. A cyclotron accelerates charged particles outwards from the center of a flat, cylindrical vacuum chamber along a spiral path. A cyclotron is a type of compact particle accelerator which produces radioactive isotopes that can be used for imaging procedures. Stable non-radioactive isotopes are put into the cyclotron, which accelerates charged particles to high energy in a magnetic field. When the stable isotopes react with the particle beam, a nuclear reaction occurs between the protons and the target atoms, creating radioactive isotopes for nuclear medicine and other purposes. How does a PET scan work? I added a video for everybody to have an idea on how does a PET scan really works.
Meet Dave. He's about to have a brain scan. Using the latest PET imaging technology, doctors will see Dave's brain at work. It's all possible because of tiny tracers, specially designed radioactive molecules. The PET scanner tracks the position of the tracers inside Dave, revealing his brain function in 3 dimensions. The tracers don't come from a stockroom shelf. Each one has to be made fresh at a nearby laboratory. This is Dr. Miller. He's making the tracer for Dave's PET scan. First, he needs to produce the radioactivity using a device called a cyclotron. It smashes high-speed particles into ordinary atoms, transforming them into new radioactive atoms. Now the clock is ticking. The new atoms are giving off their radioactivity, becoming plain old regular atoms again. There goes one. It means Dr. Miller and his team have to work quickly to build the tracer, a biological molecule. This is what makes PET so unique. The molecule could be anything: a sugar, a protein, a hormone. Each one is tailored to a specific function in the body and will show doctors where in the body that function is happening. Dr. Miller's team runs special chemical reactions to create a tracer from a drug used in the brain. The new tracer must pass quality control. It is purified and checked that it will function properly. The tracer is ready to use. Good work, Dr. Miller. The precious custom-made molecule is rushed to the PET clinic. Just the right level of radioactivity is measured out. Then it's injected into Dave's bloodstream. There'll be a sharp scratch. It's not long before Dave's brain has absorbed the tracer, and the clever chemistry gets to work. Inside Dave, an incredible reaction is taking place. The radioactive atom on the tracer loses its radioactivity, giving off a subatomic particle called a positron. It's just like the tiny negatively charged electrons found on all atoms, except that the positron is positively charged. So when the positron hits an electron, at just the right speed, they combine and destroy each other. The energy is released as 2 gamma rays that travel straight out of Dave's body in opposite directions. The PET scanner is like a big ring of Geiger counters. When it detects 2 gamma rays on opposite sides of the ring, the doctors can calculate where in Dave's body the tracer must be. By detecting thousands of these events every second, and with some clever computer processing, Dave's brain activity is revealed in 3 dimensions, something no other imaging technique can do. For Dave, it was just a small injection. That wasn't so bad, huh? All made possible by the incredible technology of the tracer. The potential for PET is enormous. Different tracers can detect cancer, test heart function, and even track Alzheimer's. The PET scan has revealed Dave's brain is functioning as it should. Dave, you're A-OK. In the next hour or so, his radioactivity levels will be back to normal. It's another successful job for the incredible tracers. But the work of Dr. Miller goes on as he continues creating new tracers to help those in need.
Thank you, and that's all. I hope by now you have an idea what is a PET or positron emission tomography and how does a PET scan really works. Thank you. Have a nice day. Stay safe.
So thank you so much for watching among the topics that is discussed by the speaker. So now at this moment, I am going to discuss on the SPECT or the single photon emission computed tomography. By the way, I am Devin Revilla. Okay, so let's start our discussion. The single photon emission computed tomography or SPECT is combined with computed tomography was introduced as a hybrid SPECT-CT imaging modality 2 decades ago. The main advantage of SPECT-CT is to increase specificity achieved through a more precise localization and characterization of functional findings. The improved diagnostic accuracy is also associated with greater diagnostic confidence and better interspecialty communication. So these lead to greater diagnostic accuracy and a more profound diagnosis to a specific disease. So now, let's go on with what's all about SPEC. Okay, when we hear the word spec, when it comes to your mind, it drastically or it talks about nuclear imaging or nuclear medicine. So, by the way, this SPECT or single photon emission tomography is part of the nuclear medicine. So, what's with this nuclear imaging? So, basically, this is a type of modality that uses gamma radiation, but in a different way. Why? Because diagnostic imaging just involve only for diagnosis. But with regards to nuclear medicine, it involves in both diagnostic and therapeutic purposes of the patient. Okay. So what's all about this spec? Okay. Spec is considered as has a hybrid imaging. Okay, hybrid imaging when it comes because it translates molecular and metabolic information into an immediate clinical impact for a wide range of diseases. Okay, so let's view the slide. Okay, now, in this also further improves the diagnostic accuracy and specificity and positive predictive value of nuclear medicine studies. So this is the great advantage of the single photon emission computed tomography. Now, this involves scintigraphy. So, what is scintigraphy? Scintigraphy is characterized by an inherent high sensitivity and negative predictive value, or NPV, which is enhanced by SPECT, which is a single photon emission computed tomography. Now, the use of SPECT-CT is rising in frequency and spreading to new clinical settings. Recent trends in sales of new clinical or new nuclear medicine equipment confirm that the installation of SPECT-CT devices exhibit a step surge worldwide. The value of SPECT-CT towards improved staging, prognosis, and treatment planning and monitoring for a wide variety of diseases. Okay, so over the last decade, um, the significant advances in technology have taken place. Why? Because for these reasons, it was deemed appropriate to undertake an up-to-date review of the current issues and trends in the spec city, not only for problem-solving approach, but also in the most important as diagnostic tool, fully integrated into clinical approach. Okay. Now, this imaging modality or the current application of this imaging modality is in cancer, which needs a lot of critical review. Now, in oncological diseases, it has or it needs a beneficial procedure for the individual as a patient. It is very imperative. Okay. Now, The availability of both functional and structural data has resulted in a proven synergistic effect on diagnostic potential in the assessment of cancer. So that's the important aspect. Why SPEC is very useful in diagnosing cancer. Now, we have the sentinel lymph node mapping. So it is one of the clinical application of SPEC. So this is one of the trend, okay? So the detection of lymphatic metastatic involvement is important in staging, prognosis, and treatment of various malignancies. Following interstitial radiocolloid injection at the site of primary tumor, scintigraphy visualizes its lymphatic drainage. The term sentinel lymph node or SLN is used to describe the draining or describe the first lymph node encountered by the lymphatic vessels draining the primary tumor. Lymphatic drainage is very complex and SPECT-CT can achieve the accurate pre-surgical mapping with further implementation into a personalized surgical approach. So that involves in the sentinel lymph node mapping. So also in the breast cancer imaging, where SLN mapping is a well-validated data. So similarly, SLN mapping has been validated to patients with intermediate thickness melanoma. Okay, in this early stage, in this early stage of the head and neck malignancy, SLN biopsy is increasingly used for treatment stratification, being associated with decreased morbidity and better outcomes as compared to elective neck decision. So the addition of SPECT-CT to the dynamic lymphoscintigraphy in oral carcinoma revealed additional information of 3% patients for an overall detection. And also in gynecological cancers, SLN mapping using SPECT-CT facilitates intraoperative SLN biopsy in cancer of the cervix or vulva. The SPECT-CT localization of SLNS was found to be anatomically accurate in 91% of endometrial tumors, a malignancy which a low prevalence of nodal metastasis. One progressive study demonstrates that the value of SPECT-CT in penile cancer, improving both in the L and detection rate and their precise localization in drainage bases. So therefore, it is imperative or it is very useful that this SPECT-CT improves the detection of sentinel lymph node mapping as aid in cancer treatment. Okay, so now to proceed, okay. So next thing we have is that they for thyroid cancer. Okay, thyroid cancer is one of the very important or one of the very common usage for this SPECT-CT. Why? Because recent guidelines present in optimal modalities of differentiated thyroid cancer or DTC management. Okay, the selection of patients for post-surgical radioiodine or RAI ablation is based on the clinical and histopathological risk stratification. The RAI whole body scintigraphy at the complexion of ablation can change the risk of stratification. So with this, SPECT-CT provides additional information mainly by clarifying equivocal planar findings, by which it is identified on what? Okay, the RAI SPECT-CT has been compared with RAI WBS at various stages of DTC, wherein it is the differentiated thyroid cancer, that's DTC. Now, including pre and post ablation and after therapy of recurring the metastatic disease. Prior to ablation, the RISE SPECT-CT identified unexpected cervical nodal metastasis in 30 to 44% and the distant lesion into 4 to 10% of cases, leading to a change in management in 30 to 60% patients, mostly receiving higher RAI treatment doses than initially planned. Okay, after ablation, the SPECT-CT was significantly more specific than WBS with or without cases. Okay, now the treatment of the RAI SPECT-CT and WS showed pre-treatment SPECT-CT performed better than planar WBS or using the fluorine 18 FDG PET-CT, while post-therapy SPECT-CT performed better than WBS but worse than the fluorine 18F-DG PET-CT. So this also applies that this SPECT-CT is very accurate in handling or conducting diagnosis to thyroid cancers. Okay. Now, to proceed is another clinical application to neuroendocrine neoplasms. Okay, neuroendocrine neoplasms are the heterogeneous group of tumors originating from a single clustered neuroendocrine cells, which are located in the gastrointestinal tract and lungs, and less commonly in the thymus, adrenal medulla, and the pituitary, parathyroid, and thyroid glands. So having a non-specific clinical presentation or neuroendocrine neoplasms or NENS or represents a diagnostic and therapeutic challenge. Why? Because according to the European Neuroendocrine Tumor Society, the diagnostic and prognostic stratification on histological typing, differentiation, grading, and TNM staging. Imaging plays a fundamental role in the diagnosis, staging, treatment selection, and follow-up of NEN, specifically stingray tumor somatostain receptor. So as you can see that this is the video of a part of the neuroendocrinal metastasis or neoplasms rather. So this picture presents in in indium 111 somatostatin spexity in neuroendocrine neoplasms. This represents a 34-year-old patient with biochemical suspicion of NEN and a lesion in the head of the pancreas on CT was referred for this type of imaging modality. So now, looking back at the other parts, we have also bone metastasis. Okay, the bone metastasis or scintigraphy detects metastasis in the presence of a reactive increase in bone formation. The CT now visualizes osseous tissues or metastasis in the osseous tissues as a difference in density relative to the normal. So we can differentiate on basing on the density of the bone. Okay, looking back, so these are associated with worse prognosis and decreased survival. So with the aid of the SPECT, now the bone scintigraphy is a low quality or hampered lack of gold standard, but its sensitivity is ranging from 85 to 96%, which is limited by spatial resolution of a planar and SPECT studies. Right. But it does not detect small osseous metastases unless they exhibit high uptake, such as in prostate cancer. Okay, to proceed, so that's a picture of a using a technetium-99M DPD bone spexity in a patient with renal cancer and bone pain. So this is for a 62-year-old patient with renal cancer was referred for evaluation of painful left elbow, which detects an early planar scan of the elbows. It shows intense hyperemia on the left side. So as you can see on the left side, and then delayed whole body scintigraphy or the posterior view demonstrates intense inhomogeneous focal uptake in the distal part of the left humerus, localizing the spexity to an osteolytic metastasis seen on the CT component. So, nandun siya sa letter C na picture. Okay? Now, to proceed, we have also this prostate cancer. Okay, the development of PET radioligands detected against the prostate-specific membrane antigen or PSMA was revolutionized. Okay, the diagnostic workup of prostate cancer. Why? Because they utilizes only the technetium-99M labeled PSMA ligand agents have also recently been developed. So the SPECT CT with technetium-99M MIP 10404 PSMA ligand subtype enable the detection of small LNs or additional metastasis, SPECT-CT achieve sensitivity up to 97 for diagnosis of primary prostate cancer. So, this involves greater diagnostic accuracy towards the prostate cancer because as the prostate cancer is very common in males, so it detects or it is very highly relevant to all males, no? So they develop as the age goes higher, or this prostate cancer is predominant um, when the age of the male patient is increasing. So that's all about the prostate cancer. So now, as you can see in the picture, no, it shows that the use of technetium-99m MPI 1404 PSMA, that a patient with prostate cancer, it is an 18 years old man with prostate cancer and with biochemical recurrence diagnosed by increased serum PSA levels. All right, so that's okay. The picture A shows that multiple sites of focal abnormal tracer uptake above and below the diaphragm. Okay, on the transaxial image of the SPECT-CT slices at the level of the upper thorax, on the next picture, it demonstrates the presence of left internal mammary chain or lymph node metastasis, and as well as the transaxial of the upper pelvis shows multiple partially MIP 1404 avid osteoblastic lesions in the bone consistent with functionally active and inactive skeletal metastasis. So that's all about the prostate cancer. So meaningly, this imaging modality has been an increased range of utilizing in the diagnosis and the monitoring of prostate cancer. Next, also, we have this transarterial radioembolization. So, the liver represents frequent site for primary cancer and metastatic disease. Transarterial radioembolization, or TARE, uses percutaneous intraarterial techniques to inject micron-sized embolic particles or yttrium-90 or more, representing which H0166 microspheres for treatment of malignant liver lesions. The beta irradiation favors destruction of the tumor cells surrounding the microvessels with high radioactive particles concentration. Now, the pre-therapy angiographic evaluation combined with scintigraphy following intraarterial technetium-99m labeled albumin macroaggregated lesion maps the tumor feeding vessels, which quantifies potential liver to lung shunting and can detect the presence of blood reflux to the bowel, stomach, or pancreas. Now, with this image, so it shows the whole liver, the bilobar, and the subsegmental liver on what will happen with this transarterial radioembolization. So it's primarily focuses on the liver to decrease the hypersensitivity of the blood that comes from the liver, or that flows from the heart, from the liver, which then contribute to certain disorder. Okay, so to proceed our topic, that's all about on the oncological applications of the SPECT. So now, let's proceed to the non-oncological application. So, yung SPECT pala, or the single photon emission computed tomography, does not only limit, okay, does not only limit to the application to its oncological disease, but as well as into a non-oncological disease. When you say non-oncological disease, it involves non-cancerous disorders. So, bakit kaya siya? So, okay, what are the trends or the application of SPECT in the non-oncological applications? Okay, we have these benign skeletal conditions. With the use of technetium-99m methylene diphosphonate or MDP bone SPECT-CT plays a pivotal role in the assessment of musculoskeletal or MSK diseases, including in a patients with chronic, with chronic pain or with inclusive cross-sectional imaging results. Now, in this video, it represents that a patient with a painful left foot of a 70-year-old patient with persistent pain on the left foot was referred for bone scintigraphy for detection of the pain generator. Now, early planar scan of the feet, which has a delayed whole body scan and show focus on hyperemia and intense tracer uptake in the posterior aspect of the left tarsal region, wherein it localizes by SPECT to severe degenerative changes in the left talonavicular joint seen on the CT component, which is here. Okay? Now, given to the fact that it also contributes to the diagnosis of benign skeletal condition. So it also entails to infection. Okay, it also diagnose infection. Why? Because the diagnosis of an infection process is based on clinical and laboratory data, but the localization is very difficult. With the aid of SPECT-CT, infection seating tracer labeled with single photon emitting radionuclides include the autologous leukocytes, which is in a base of white blood cells labeled with technetium-99m hexamethylprofanolamine oxime or HMPAO or indium-111 oxime, and to a lesser extent, radio-labeled antibiotics, antibodies, and 99, technetium-99m to BQcidin 29 to 41. Okay. Now, the infection of this side optimizes the SPECT-CT optimizes the diagnosis of clinically suspected MSK infections and the localization of unknown processes. This is useful in cases when bone involvement has to be proven or excluded in the presence of soft tissue infection or for assessing the extent of OM in a complicated anatomical region such as post-surgical alterations or close-implanted medical devices. So now, let's also proceed to the SPECT localized foci of infection that is being viewed in the image. So as you can see in the image, here it goes. So it is a using technetium-99 HMPAO labeled leukocyte SPECT-CT in a patient with diabetic foot. So nakita niyo yan siya. Now, a 43-year-old man with diabetes mellitus in an infective wound in the medial aspect of the left foot, forefoot was referred for technetium-99m HMPAO leukocyte scintigraphy for suspected osteomyelitis. Planar scan shows, as performed in A, that there is at the base of the first left digit, there is an increasing in intensity in its superior aspect, okay? The SPECT-CT locates this uptake for fragments of the first left metatarsal bone, showing areas of cortical erosion and sclerosis, as well as the adjacent deep wound and surrounding edematous soft tissue, consistent with osteomyelitis in addition to soft tissue infection. Okay? That's all about infection. Now, it's also diagnosed parathyroid disease. What are the implications to this to the spec with regards to parathyroid diseases? So when you say parathyroid diseases, okay, it uses the technetium-99m system B for SPECT-CT is used in the workup of patients with hyperparathyroidism or HPT, wherein there is a variable acquisition protocols are used, including single tracer dual phase studies and subtraction imaging following technetium-99m per technetate or iodine-123 iodide administration. The time of SPECT-CT early, late, or twice during the imaging has been described. So it is very vital to know more on this aspect with regards to parathyroid disorders. Okay. So now let's proceed to another. Okay. For this type of disease, no, the SPECT-CT is a good criteria for defining patient eligibility. So the positive result of the SPECT-CT for surgery and for surgical procedural planning, particularly in the presence of thyroid disease such as multinodular goiter. Okay, with the aid of this, uh, the patient is now being diagnosed or for clinical preparation. Okay. Next, we have also the lung disorders. Okay. Ventilation and perfusion imaging is routinely used in the workup of patients with suspected pulmonary emboli or PE. In planar or VQ scans, distinction of anatomical segments is very challenging and it's difficult to determine the extent of embolic involvement. The CT pulmonary angiography has gradually replaced VQ scans for PE being widely available and having high sensitivity and specificity. Nevertheless, the CTPA is limited by technical artifacts, conscious allergy, or poor renal functions. Okay, this SPECT is also applicable for cardiology. Why? Because coronary artery disease is the number one cause of cardiovascular morbidity and mortality. The current guidelines recommend that patients with low pretest probability for stable CAD undergo cardiac computed tomography angiography or CCTA, which has a high NPV, while patients with high pretest probability should be referred for invasive coronary angiography or the ICA. The application for this cardiology has been very common part of the SPECT CT. Now, let's proceed. So that's the image shows a, a coronary arterial disease na patients. Now, this is a SPECT CT. Now, let's proceed to the neurology. Okay. The SPECT imaging of the brain perfusion is performed in cases of dementia and epilepsy using technetium 99M HMPAO or 99 technetium 99M ethylene cysteine dimer or ECD. The addition of CT to SPECT has not led to breakthrough in this setting, in part of because CT is not the procedure of choice for brain imaging, with MRI being the better tool. Kasi nga, mas better sa MRI ang mga soft tissues, and brain is part of the soft tissues in the body. Now, so neurology, okay, let's proceed with the gastrointestinal tract, okay? The active gastrointestinal bleeding is detected by conscious angiography or endoscopy and present at the time of study is performed. Well, using the technetium 99M labeled red blood cells or RBC scintigraphy is highly sensitive, non-invasive tool to detect intermittent bleeding. Why? Positive studies identify patients who need immediate treatment if the site of bleeding is localized. Okay, SPECT-CT was found to improve bleeding source localization over 30% of cases and increase sensitivity from 89 to 93 compared to planar scans. So this is also concerned that during the relatively long SPECT-CT acquisition, patient motion or bowel artifacts can affect correct localization of the bleeding site. Okay. Next also, we have the pediatric applications of SPECT-CT. The use of SPECT-CT in children and adolescent patients can reduce the number of equivocal studies and spare further diagnostic workup. So, however, in the practice of CT, children requires expertise to balance the best diagnostic yield with minimum radiation burden, wherein there is a use and extent of CT field should be selected based on clinical question, scintigraphic findings, and previous imaging modalities. Okay. Now let's proceed to incidental finding CT. So aside from the scintigraphy, because of the rapid increase of the use of diagnostic quality SPECT CT studies, incidentalomas or unexpected findings not related to the initial diagnostic inquiry are often detected on the CT component. Kasi after conducting the SPECT, no, or the single photon emission computed tomography, the CT scan now will follow. Okay, it is part of the machine wherein it is now obtained through the use of a CT scan, okay, after scintigraphy. So, but then, after ng SPECT examination, there is the incidental CT findings or the incidentalomas. So, makikita yan siya on the basis of the treatment or of the diagnostic purposes. So now, to conclude this these innovations in single photon and computed tomography, so let's have this. Okay, so the single photon emission computed tomography is a widely used. Okay, it's a widely used imaging modality. Okay, but most probably to high expense, no? But within the domain of radionuclide-based diagnostic processes or procedures, hybrid imaging has gained wide popularity, largely following our introduction of PET-CT and as well as SPECT-CT into clinical routine. The metabolic or functional information provided by the PET or SPECT is enhanced not only because of this accuracy, but also, most importantly, due to correlative assessment of altered tracer distribution with anatomical structures. This results in better performance indices for the diagnostic imaging procedure through hybrid imaging in general and SPECT-CT in particular. The nuclear medicine experts bring an important contribution to better healthcare by tailoring clinical interventions to the individual's patient's need. Okay, so I think that's the end of the trends in SPECT or the single photon emission computed tomography. So that's involve the trends in the application of SPECT. Okay, so years by time to time, no, this imaging modality has greatly improved. Okay, the diagnostic accuracy of certain disorders. So I think that we should always maintain our skills or clinical skills in order for us to perform the duties and responsibilities in the SPEC or the single photon emission computed tomography combined with CT. Okay, so thank you so much for listening. Once again, this is your discussant, Devin Arivilla, saying thank you so much for listening all about the current and future trends of CT or the SPEC CT. Thank you and bye.